Hi, hello everyone. My name is Maharlika Diarse, and today I'm going to be doing the central line dressing change skills video. Before I start, I am wearing my Nightingale scrub top, Nightingale scrub bottom, and Nightingale badge. My hair is up. I have no nail polish, no gel polish, no acrylic. I have no excessive jewelry. To start off, I'm going to name my supplies. I have a pair of gloves, 2 masks, a pen, my central line dressing change kit, and my patient here with the Tegaderm on there already. Alrighty, my patient, and then this is the distal end where the clamp is at, and I taped my patient right here. I taped the tubing onto the mannequin just for the skills video, and there's a Tegaderm there from the initials of the previous nurse. Alrighty, that changed it. Alrighty, so I'm going to wash my hands, and then I am going to knock on the patient's room, provide the privacy curtain. I'm going to wash my hands, and then I'm going to introduce myself to the patient. Mr. Smith, I am here, and my name is Maharlika. I'm going to be your nurse today, and I'm going to verify the patient wristband information, and then if it correlates with the doctor's orders. And all right, everything's perfect. And then I'm going to say why I'm here. Mr. Smith, I'm here to change your central line dressing. And already provided privacy curtain, and wash my hands again. And then now I'm gonna put on just kidding, I'm gonna put on my mask, and then I am going to provide a mask for the patient. Mr. Smith, if you could please put this on. All right, let's pretend you put it on. Then I'm gonna wash my hands again. Now I'm gonna put my gloves on, apply clean gloves. So, Mr. Smith, are you in a comfortable position? Yes, he is. All right. So, with my non-dominant hand, I'm going to stabilize the catheter right here. And then, so we're going to be taking the Tegaderm off. I'm going to, while stabilizing with my non-dominant hand, I'm gonna start taking off the Tegaderm from the outer corners. And it's a little tricky because this is a fake skin, and then I'm gonna work inwards. As I'm working inwards, alrighty, and everything is good. Now I'm going to I'm gonna throw that into the trash, and since the Tegaderm is finally gone, I am now going to inspect the site. And while I'm inspecting the site, I want to see the integrity, to see if the central line is dislodged, or if there's any kinks, if there's any like drainage. Everything here looks great. I'm also going to check if there is any redness or swelling, any signs of irritation. There's none. And I'm just checking the surrounding skin. Everything looks great. So now, since there's no concerning factors, I'm going to ask Mr. Smith. Mr. Smith, is there any pain? On the site? And Mr. Smith says no. Now we are good to go. Everything is great. The site looks great. So now I'm going to take off my gloves and dispose it into the trash. I'm going to wash my hands. Now I am going to open up my central line dressing change kit. So I'm going to open it up away from me. Now I'm going to take out the sterile gloves, and there is a 1-inch border where I could touch, and alrighty, so now I'm just gonna pull it downwards, the border right here, Now there's a 1-inch border right here. Just gonna open it up. Now I'm going to do my left hand, my non-dominant hand, and I'm just gonna put my gloves on right there. Now I'm going to get my right glove, and now I'm gonna put it on. Alrighty, so I interlock my hands. Now I am going to get the chlorhexidine. This is all sterile. I'm gonna get my chlorhexidine right here. Then my tweezers. So I'm gonna grab the distal end with my tweezers gently. Just kidding, like this, gently. So now with the chlorhexidine, I would normally just press these two and then the chlorhexidine solution would come out. So now I am just going to do a back and forth motion on all 4 sides right here on the skin. 1, 2, 1, 2, 1, 2, and now I'm gonna lift the side of the tubing right here. 1, 2, and then now I'm going to wipe the bottom of the tubing upwards, and then the top as well. Now I'm gonna lay it down right there. So now that it is clean, I'm going to dispose the chlorhexidine and the tweezers. And I want to make sure that the area is fully dry. Now that it is fully dry, I am going to put the new dressing on. So as I put the new dressing on, I'm going to throw this away right here. Make sure that the whole site is dry, completely dry. And you see this pointy end right here? That's where the end of the central line is supposed to be. Now we're going to cover the central line. Make sure there is no air bubbles and it is fully covered nicely. And everything is visible. All right, everything is great. Now I'm going to gently take off the white borders. It's a little tricky because of the fake skin. And everything's correct, all right? No air bubbles, no nothing. Everything looks great. Now there's this part right here where I'm gonna take off. Well, actually, I'm not gonna take off. Throw that away first. I'm gonna use my pen. Now I'm gonna initial a sign, and then the date, and then the time. All right. Now I'm going to take off the tape here, and I am going to attach that onto the dressing. Perfect. All right. Everything looks great. Now I can start throwing away all my supplies. Put this away. Oops, that did not happen. Just gonna throw this away right here. Mr. Smith, are you okay? All right, I'm gonna also throw away my pen. And then now I am going to take off my gloves. Throw them away. I'm gonna wash my hands. I'm gonna take off my mask, throw it away. I'm gonna wash my hands. Mr. Smith, are you comfortable right now? All right, perfect. And now I'm going to make sure his call light is there and he's in a comfortable position. I'm going to document my findings, and then that's it. Thank you so much.